I could create a situation to make you see me in a particular way.
What is that?
Well, let's say I make you trust in me. Mm-hmm. And I can recognize that you do trust me. But actually, my core self is untrustworthy. I'm fraudulent, I'm actually exploitative, and so on. And that's an antisocial position. So I create something, as it were, or form that, but actually it's not real. It's not how I am.
Right. It's not a true representation of I.
Yeah. So it gets really complicated.
Wow.
When you're working with people who are antisocial, for example, it's quite important to begin to sort of distinguish what the I actually is.
Right. And do they know what the I is?
Well, they may or may not, but they will generally insist they do. And they're very clear about it. And it's not for MBT to say you're not really that. MBT just opens that up and asks, well, actually, where's this coming out of? What's it like? How does this function for you? And so on.
For people who have an antisocial valence, is that right, it's like some biology and growing,
yeah, sure.
It's both nature and nurture. In other words, if you were in an environment, though, where your I mode was jangled, right, by different intermittent, strange, inconsistent responses, you would have nothing to hang on.
No, but what you can do, of course, when you have nothing to hang on, is create something to hang on. So you can, as it were, deactivate as much as possible and create your best adaptive position in relation to your environment. Particularly in antisocial, they rightly say, you would be like me if you were living and lived in the context of which I've lived, been brought up, and I now live.
Right.
And to a large extent, it's absolutely right. This is the best adaptation that they've got to maintain a self in this context. So what I become is someone who is impenetrable. You don't touch. So, for example, I could bulk myself up to make myself physically look that you don't come near me. And my responses could be continually sort of slightly coercive or a little bit threatening, intimidating, and so on. I could do that, for example. Or I could do the opposite. I could be quite antisocial, but I could avoid, so I actually don't interact too much. It will vary, right. but I try to hold it steady.
But then you do things in interaction with people where you make them perceive you a way that you're not, so they trust in something you yourself know you aren't.
Well, it may or may not. I mean, to be honest, I think that in a sense you begin to believe your own story.
Got it.
So it's not that you know you're something else. You actually live your story and you sort of believe it.
And the problem is that when you live, right, so if you're someone who ends up incarcerated and there's a lot of benefit to what the work you're doing in that, or there's possible redemptiveness in it, because if you believe that story, then of course you've acted as you've acted because you have believed it. Yeah. And it could well be that story that you believe, which was partly built by the environment you were in, that told you to be the way you had, or you had adapted to be that way. That's so hard to fix.
Yeah, absolutely. So yeah, and we know it's very hard to fix. I mean, the research literature shows us that. So what we've been trying to do in Mentalizing with this group of people is create the circumstances where they might begin to question each other and see each other somewhat differently. So let me just try and give an example. They tend to see through each other better than we see through them, if you see what I mean.
So they see through. Can you give me? Yeah. Can you? Give me
so somebody may present in a certain way, but they pick up the subtle signs that there's something a bit more complicated, and they're much more liable to speak it out. They're less inhibited. So they'll say things, that others perhaps wouldn't.
Like, what would be an example of someone with an antisocial psychopathology, where they pick something up
Yeah. All right. Let's
most
say
I would
someone.
miss.
Let's
Let's
say
say I
someone
would
in the
miss it.
group takes the phone out of their pocket and starts texting. Yeah, that's just
In the middle of a group.
in the middle of a group.
Right.
What are you here for? One of the other patients say to him, "What are you here for?"
Because you're taking the.
What do you mean? No, hang on.
Okay.
What are you here for? Yeah, I'll be with you in a minute. Hang on a minute. No, what are you here for? You don't have phones in here. Are you serious about being here? We don't have phones. And if you want to use your phone, F off. Do you see what I mean? Now, no clinician's going to do that. A clinician might say, oh, he's avoiding, or, maybe we were meeting some subject he wanted to get away from. We'll have all sorts of kind of clever mentalizing around this action. Yeah. But they actually say, you can't do that. So they very quickly get to the sort of crux of something. Now, then you've got a situation in the group you've got to sort out. So, in various ways, and we try and sort that out. But they can be very direct. And they can be quite direct to each other, but they will take it from each other. And partly because mentalizing, we will accept others and how they're thinking about us in various ways if we see them the same as us.
Which is why group work is so great.
Yeah, so we've tried to study this and create a mentalizing intervention for this group, in groups.
So how would, if something like that were to happen in group, what then, because that person who says, what are you here for, to the other person?
Yeah, he's been quite direct and assertive, if not aggressive. So then we've got a little bit of a problem because he's been so direct. So we very much might, at that point, do what we call siding. The person who's texting, we kind of maneuver ourselves to be on their side, if you see what I mean.
Because they've been
attacked. So, and that's really important because you're always trying to make sure we're not here to engage in sort of attacking each other. We're here to engage in actually working out what's happening. So we would do what we call siding with him first off. So you might come back to the other person and say, God, that was pretty direct, Stanley. Kind of. Well, what effect did his texting have on you to bring you out like that? Do you see what I mean? We might get him to start saying, actually,
wow,
that does this to me. Okay, when you do that, wow, it makes me think, because I was talking, it makes me think you're not taking me seriously. And remember what that is? That's teleological mode. You engage in an action, don't you? Take your phone out and start texting. When I'm talking, you're not listening. You don't care about what I'm saying. You've no interest in me, and I'm reacting to that. So we've got a whole ton of stuff just on this interactive process about what may be going on for him, and then what's going on for this guy. And then we can try and move that around.
Wow. And by doing that, you're beginning to maybe help them find the core self or something, like by saying what's going on for you.
Yeah.
I mean, you're trying to begin to have them reflect.
Yeah, I want you to reflect now on that self-experience. Where's it coming from? Actually, what makes you as sensitive to that? Is there a lot of fuel in that somewhere coming through at you, which you actually have to be sensitive to about yourself? Maybe they're sensitive to not being taken seriously, that people have never really taken up actually understanding it from their perspective, and they're really reactive to that. You're just trying to generate that self-reflective process for that person, but now in the context of with others.
What has been your observation, the people that are in a group and are learning, encouraged to be more reflective, what happens over time with that?
Well, I mean, the true answer to that is I don't know at the moment, because we had a whole research project, but the outcomes are not yet known. So we'll see. But just subjectively in what you see, they do become much more reflective, and they do become a little bit more compassionate about others. Because one thing they're not so good at, they don't really care about reading the other person that much. Okay, because reading the other person, for example, could create all sorts of pain maybe for them and so on. Because particularly if they've been in a brutalizing environment, why do you want to read other people's minds? They're just horrible anyway. Do you see what I mean? Yeah. So you can close that off. But they can sometimes be very good at actually knowing how people are and how they feel and what they're experiencing cognitively. So they're quite good at cognitive recognition, but they're not very good at subjective empathic recognition of somebody's overall state of mind, of the other person.
And people would say, that's not possible. to fix that, to improve. They're just inherently, I mean, we just had 2 people in here who are sort of focused on studying and working with narcissistic personality disorder. And with narcissism and NPD, narcissistic personality disorder, people have the capacity for empathy. It's the difference between closing your eyes and being blind. And if you choose, you can work on opening them. And that I think the presumption was that with an antisocial diagnosis, it's just not there at all. But what you're suggesting is maybe that's not the case.
Well, I would worry that that's just a hell of an assumption to carry on with. And
that's actually, let me own it. I think that's my assumption.
No. Well, it may be, but
that.
it's a common assumption.
Yeah.
Because you can't help these people. They can't change. It's the change, isn't it? Really, we're talking about. But I think that's a hell of an assumption to make, because we know that there's huge flexibility in brain function, in mental functioning, in relational functioning, over time, and that doesn't stop.
Yep.
Okay, so why would it stop here? I mean, we could argue, that developmentally, that because it's been closed down, maybe through brutalizing environments, trauma, and so on, there's a sort of use it or lose it, and they didn't use it because it was closed off, so you lose it. But actually, it may not be like that. It might be use it, close it down, start regenerating it, and so on. And really, that's what you're trying to do. But we'll see whether that has had an effect or not. Okay.
That has huge implications because, well, certainly in this country where our prison system is like a huge moneymaker, it would just append a prison system base. I mean, it would basically say there is, not with everyone, but there is, we have methods for actual rehabilitation.
Yes. What, as it were, needs rehabilitation? Is it just stop behaving like that, or is it actually the way your mind is working and actually how you see things and how you experience things, what assumptions you make, which may not be serviceable for working in the social world, and so on? Because what we're trying to do in MBT in the end is allow the patient to be able, from the mentalizing, to take advantage of sort of favorable social interaction.